Hello guys, I am Dr. S.S. Misra. Today we are going to study about production diseases of cattle. Production diseases. This is called as metabolic disease also. First disease, that is milk fever or parturient paresis. Paresis. Parturient paresis is an acute to per-acute non-febrile disease occurring in dairy cows or buffaloes around time of parturition. The disease is clinically manifested by weakness, recumbency, and circulatory collapse. Weakness, recumbency, that is sternal recumbency, lateral recumbency, and circulatory collapse also. It is a non-febrile disease. In this in this disease, the temperature is in subnormal condition, means less than the normal temperature. Means temperature will be like 96 degree Fahrenheit, 98 degree Fahrenheit. Normal body temperature of the cattle is like 101.5 degree Fahrenheit, means 100.8 degree Fahrenheit to 101.5 degree Fahrenheit. Like this is the normal temperature, but in milk fever, the temperature will be less than the normal temperature. What is the etiology? Sudden loss of calcium into milk. Etiology is the sudden loss of calcium into milk during onset of lactation at parturition or near the parturition. Sudden loss of calcium into milk during onset of lactation at parturition or near the parturition, resulting in low levels of ionized calcium. Ionized calcium in tissue fluid causes onset of hypocalcemia. In means in blood of the animal, normal calcium level is 9 to 11 mg per deciliter, but suddenly the calcium will be released through milk and there is a deficiency of calcium in the body of the animal that results in hypocalcemia, and the plasma calcium in milk fever is reduced to a level of 2 to 7 mg per deciliter. Commonly the phosphorus level also decrease, and cows are hypoglycemic. Feeding of calcium rich diet more than 100 gram of calcium daily during the dry period increases the chances of disease. If we fed the calcium rich diet more than 100 gram of calcium daily at the time of dry period, the dry period is 60 days in cattle. In this period, if we fed the calcium rich diet, then it increases the chances of this disease, hypoglycemia, at the after the parturition. Alkaline diet with an excess concentration of sodium and potassium increase the incidence of hypocalcemia. Since most of the leguminous fodder and grasses are alkaline and rich in potassium, the chances of milk fever are more when legume-rich diet is fed during the prepartum period. Prepartum means before parturition. When we fed the legume-rich diet, the chances of hypocalcemia will be more. What is the epidemiology? Epidemiology. Mature, high producing cows and buffaloes in the age group of 5 to 10 years at their third to 7 lactation are relatively more susceptible. Third to 7 lactation more susceptible. Cows of Jersey breed are thought to be more prone to Jersey breed. It's we have to remember Jersey breed. Prone to milk fever, frequently found in high yielding dairy cows. Composition of diet during dry and prepartum periods and environmental factors influence occurrence of milk fever. At the time of dry period and prepartum period, what type of composition of diet, whatever we are providing the diet, that will result in the occurrence of milk fever, more common in late winters, spring. Let's come to symptoms. There are different stages of the symptoms. In the first stage, the animal remains standing but is disclined to move and becomes anorectic. Anorectic means anorexia. It remains static. Anorexia means no food, no ingestion of food, no ingestion of food. Anorexia, complete absence of appetite, complete absence of eating of food. Rumen status, agalaxia means rumen will be in static condition. Agalaxia and a brief stage of excitement and tetany with hypersensitivity, shaking of head, protrusion of tongue, grinding of teeth, tremors of head, limbs are the common signs. These are the signs. The rectal temperature is normal or slightly above normal. This is in the first stage, slightly above normal. In the second stage, cows and buffaloes are unable to stand and suffer from prolonged recumbency. Recumbency means it will lie down on the floor and it is unable to stand. Okay, highly weak, emaciated condition. Prolonged recumbency with lateral kink in the neck or head tucked into their flanks. The muzzle and eyes are dry, extremities are cold, and temperature is subnormal. Here you have to know temperature is subnormal. Subnormal means less than the normal temperature. Less than the normal temperature means 98 degree Fahrenheit, like this, or 97 degree Fahrenheit. There are signs of bloat, rumen stasis, constipation. Inability of animals to urinate is reflected by distended bladder. Inability of animals to urinate is reflected by distended bladder. Now come to the third stage. The third stage is marked by lateral recumbency, and the animals are almost in comatose condition. Comatose means coma-like condition. Severe bloat, low temperature 95 degree Fahrenheit or 96. Increased heart rate with almost inaudible heart sound, impalpable pulse are seen during the stage. Clinical outcome in milk fever may be complicated by concurrent hypomagnesemia or hypophosphatemia. Hypomagnesemia, magnesium is less in body, and hypophosphatemia, phosphorus amount also less. What is the diagnosis? The disease needs to be differentiated from hypophosphatemia, hypomagnesemia, Downer cow syndrome, carbohydrate engorgement, mastitis, toxic metritis, other systematic toxemia. The diagnosis of milk fever is confirmed by marked decrease. The diagnosis of milk fever is confirmed by marked decrease in calcium and phosphorus concentration in serum. Here, you have to note that in serum, and a favorable response to the treatment with calcium borogluconate. Calcium borogluconate, CBG. We know all about this. Now come to the treatment part. Animals respond favorably to early treatment with intravenous administration of calcium borogluconate salt. The usual dose the usual dose for cows and buffaloes is 1 gram calcium per 45 kg body weight. 45 kg body weight. 1 gram per 45 kg, which is calculated to 400 to 800 ml of 25% solution depending upon their body weight. Rapid intravenous administration of total dose of calcium may be detrimental due to cardiotoxic effect of calcium. Due to cardiotoxic effect of calcium, we should not provide that calcium borogluconate in rapidly IV. So we should provide the CBG slowly to intravenous. Okay. Otherwise, it will lead to a condition atrial fibrillation. Okay, atrial fibrillation condition means in the atrium of the heart there is a fibrillation condition will be seen. Cardiotoxic effect of calcium. That is the cardiotoxic effect of calcium. In large heavy body weight, half of the total dose may be given by subcutaneous route after initial intravenous infusion. After intravenous, we can give half of that amount in subcutaneous route. Oral administration of calcium solution avoids cardiotoxicity in milk cases of in mild cases of milk fever. Mild cases means just started. Oral administration of calcium solution avoid cardiotoxicity in mild cases of milk fever. Means we can provide orally also. That is like calcium is there for calcium supplement in oral. Vitamin a different type of calcium fluid is coming in the market as a brand name, another name. Vitamin D 20 to 30 million unit given in the feed for 5 to 7 days before pasteurization because vitamin D helps in the absorption of calcium from the food. The vitamin D 20 to 30 million unit given in the field for 5 to 7 days before pasteurization. We have to remember this. Okay, thank you.